Preventive geriatrics. Geriatrics means old age. But this word is a wrong word that I have used. You cannot prevent old age. That can only be prevented if a person goes off early. So preventive geriatrics is not old age. It is the sickness which is associated with old age. So preventive geriatrics is a correct word that it prevents the sickness associated with old age or the morbidities associated with old age. Old age is incurable and it is not preventable, like it has to come. But I think it's an old saying, it was a theme in year 2017 that add life to years and not years to life. So you need to have the healthy living in old age. So let us see some MCQs for your preventive geriatrics. If you talk about MCQs in preventive geriatrics, first MCQ is very easy. What are the problems in old age? The problems or the morbidity in old age that we may see can be broadly classified into major or the most common morbidities. We can have other morbidities or we can have psychological changes. Psychological changes is a special category in old age because they undergo so many psychosocial and psychological changes. So if we talk about the most common morbidities, the most common morbidities cannot be one. There are multiple problems which may happen in old age. The first, if you talk about the group of morbidities, most common group of morbidities is disabilities. Disability to function as a normal life which they were doing it before is the most common group of morbidities. This disability could be joint disability, bone disability, muscle disability, so many things can happen. Eye disability, hearing disabilities. So most common morbidity group is cataract. We can have glaucoma from eye diseases. The second type is neural deafness. This is usually in tune of 40 to 50. This is usually in tune of 40 to 50 decibels of neural deafness occurs. Then there is failure of special senses. And there could be locomotory disabilities. Locomotory disabilities. Lung disability or emphysema. So patient will lose various senses, locomotion, emphysema. Other disabilities or other morbidities. Other morbidities could be many. Cardiovascular diseases form the most common organ dysfunction. Most common organ dysfunction which happens in the cardiovascular morbidity. Then another, in males it is very common to have BPH, benign prostate hypertension, hyperplasia. We can also have detrusor instability, and again very common causes is cancer, accidents and falls. Cardiovascular disease is the most common. Cardiovascular includes hypertension. So hypertension, diabetes mellitus, metabolic diseases, all these I have grouped together. So they become the most common organ dysfunction in the old age. Most common group of morbidities is disability. Disability usually called as locomotory disability. And the most common organ dysfunction is cardiovascular disease. Then there are psychological changes. Psychological, I think we all understand. Psychological changes could be broadly classified into three areas. We can have mental disabilities, mental changes, sexual adjustments, and emotional changes. So mental changes, sexual changes or sexual adjustments and emotional changes. So now the program needs to address all these understanding morbidities. Most common morbidity groups, other morbidity groups, and the psychological morbidity groups. So how the program is functioning for geriatric health or for old age in India, we have a 1999 we started with the national policy for older persons, national policy for older persons. So under this 1999 national policy for older persons, the program envisaged to open old age homes, daycare centers, vocational courses for old age people, rehabilitation centers. So under rehabilitation or recreational centers, there were provision of physiotherapies units and so on. Vocational courses for the old age people to learn new skills, maybe learn music at old age, maybe learn literature. So vocational courses and daycare courses, daycares were to be opened and old age. So this was under the national policy for older persons. This was national policy is now has undergone many changes. We have now national program for older persons and we have a Vayoshri Yojana. Vayoshri Yojana is to promote opening of old age homes under the public-private partnership. Public-private partnership to open new old age homes is Vayoshri Yojana. Why? Because India is a aging population. India is not like, I won't say aging population, but India is showing a demographic dividend. I hope you remember from your demography lectures, we talked that India maximum population is in the economic zone. After 30-40 years, what is going to happen? This will come into the old age area. So that time the country will face a big amount of dependent population. This dependent population will be called as demographic liabilities. So actually the old age is going to increase. So therefore the government has started some of the programs here and there. So you just need to remember for your exams two words, Vayoshri Yojana and national policy for older persons. Under this program, there are 2-3 strategies. So first is a primary prevention, secondary prevention, or a tertiary prevention. What is tertiary prevention? Tertiary prevention means a rehabilitation of the old age people. In case of any disabilities or in case of glaucoma, doing rehabilitative surgeries, glaucoma surgeries or cataract surgeries for the old age people. Next is tertiary care is also using social organizations or the NGOs, non-governmental organization. This was your question last year, not last year, 2-3 years back. One of the which of the following social organization is known for work on older population? It is HelpAge India. HelpAge India is a non-governmental social organization which is working for care of older population. For children, you remember CARE is the organization. For older, it is HelpAge India. And of course, one more is Rotary International. Rotary International is for almost everything. It is for mother-child health, for child health, and for older age. In secondary preventions, you are obviously doing early diagnosis and prompt treatment. We have had a lot of discussions on this. In every chapter, I think I talked about EDPT, National Health Programs in basis of infection, that is the concept of disease, concept of health, infectious disease epidemiology. We talked about levels of prevention. What are the primary prevention strategies under this program? Under the primary prevention strategies, there is improvement in the diet, there is improvement in the exercise, and there is improvement in the weight. It has been shown that in old age, these 3 things give a response in 50 to 80% of the individuals in promoting their quality of life. Diet, exercise, and weight. Out of this, if they ask you one question, it is the weight reduction which is the most important factor for promoting the quality of life in older population. It has been shown that weight reduction is the most important parameter for changing the quality of life. Other primary preventions, this can be again a question. Other primary preventions could be other lifestyle modifications like stopping smoking or stopping alcohol, or to promote socialization, So these are your policies and strategies under the national program for older population or the national program. It's a national policy for older population or national program for older persons and the Vayoshri Yojana. Under the Vayoshri Yojana, we are promoting formation of the old age homes with public-private partnership, use of NGOs and social organizations. So with that, we cover this section on preventive geriatrics.
Hi guys, please subscribe my channels.